Where do you go when you need to go? For most of us, that's an easy question to answer. We have bathrooms in our houses, schools, workplaces, and in most public spaces. But for many people around the world, the answer is not so simple. There are currently over 2 billion people who do not have access to improved sanitation facilities. In fact, more people today have a mobile phone than a toilet. And not having a toilet is even worse than you think. When people don't have toilets, clean water, and a way to wash their hands, it's very easy for feces particles to spread. They can easily be transferred from object to object and person to person through interactions as simple as a handshake. A single gram of feces can contain 10 million viruses and 1 million bacteria, and it's estimated that people without toilets unintentionally consume about 10 grams of feces a day. This can lead to dangerous illnesses like severe or chronic diarrhea and intestinal parasites. Globally, diarrhea is the second biggest killer of children under 5 and is a primary cause of malnutrition. This can have spillover effects into a child's education. Globally, children lose 443 million school days each year due to illnesses caused by lack of sanitation and clean water, including diarrhea. It also has serious economic effects. The World Bank estimates that lack of sanitation costs the world $260 billion a year in healthcare costs and lost productivity. The burden of lack of sanitation is not evenly distributed. Women and girls are particularly disadvantaged by lack of toilets. When women and girls have to use public toilets or travel far from home to relieve themselves, they are vulnerable to physical and sexual assault. They also have increased and particular needs for sanitation facilities during their periods. Toilets are fundamental. That's why Plan is committed to ensuring that girls and boys, their families, and their communities have them and can use them. Plan has sanitation programs in countries across Latin America, Africa, and Asia. In Ghana, Kenya, and Ethiopia, Plan is investigating innovative and sustainable approaches using local actors like natural leaders and teachers to ensure that communities have the knowledge, skills, and motivation they need to build their own sanitation solutions. In Cambodia, Plan is working with local NGOs and the government to implement a comprehensive sanitation program in 10 provinces, focusing not only on creating demand, but also working with the private sector to improve the supply of sanitation hardware and training the local government to take responsibility for the activities after Plan's project ends. In Kenya, Plan is working with youth entrepreneurs in one of Nairobi's largest slums to create a toilet cleaning service that ensures that facilities are clean and used. In Zimbabwe, in 5 schools, Plan constructed gender-segregated sanitation facilities for girls and boys and built water reticulation systems to ensure the students have access to clean water. Last year alone, as a result of Plan's programming, 4.8 million people gained access to sanitation facilities. And we're not stopping there, because it's not just a toilet. It's a necessity to ensure that boys and girls live cleaner, healthier, more fulfilling lives.